Well, I think we're going to go ahead and get started here. And I would like to introduce um, Bobby Brazell. And he's in recovery from heroin and opioid addiction and is a certified peer support specialist, recovery coach, family recovery coach, and certified ARISE interventionist. He's the executive director of Midlands Recovery Center and has more than 20 years in active addiction, sorry. Today, he's a very strong recovery story that he shares with others who still struggle with substance misuse, and he frequently speaks to groups of professionals who glean knowledge for his lived experience. Mr. Brazell is a leader with the Celebrate Recovery program through First Baptist Church of Lexington, where he facilitates the Men's Chemical Dependency Group, co-leads The Landing, a group for troubled and at-risk teens, and facilitates a 12-step group for men. He works daily with other addicts to navigate them through his own recovery process and understand relapse prevention, while also helping individuals implement a relapse prevention plan. He's a former EMT and worked in the medical field for 10 years. He currently is the executive director of Midlands Recovery Center and serves as a motivational speaker to help educate the public and professional community on the opioid addiction and how it looks and how recovery is possible. And today he's going to provide some insight for us as nurses on therapeutic communication, constructive healthcare interventions, and how we can be most effectively helpful when we are engaging with actively addicted individuals. So I am proud to present my bud here, Bobby Brazell.
Thank you. Hello, everybody. I want to thank you guys for letting me come and your hour with. And special thanks to the one who's up at 2 o'clock in the morning from Israel. I'll try to keep it a little lively. So, Becky said I'm in recovery. I'm in long-term recovery from heroin and opiate addiction. I'm 48 years old, and my journey started basically when I was 24 years old. It was 1994. I was 24. I was having a party for me and one of my best friends he was 20. We celebrated our birthdays together. He was not old enough to buy alcohol, so I purchased alcohol for a party. Once I passed out around 3:30 in the morning, I got a call about 6:30 that morning from his brother, who happened to be a Lexington County deputy sheriff. He told me that his brother was dead, that he and another friend of mine had left my house after I'd fallen asleep, and they were in a terrible car accident where they flew off a bridge and landed on the interstate below, and they were both killed instantly. And so for me, that meant I was in a lot of trouble. I purchased the alcohol. Not only was I in a lot of trouble, but I had a lot of guilt associated with their deaths, and I was not allowed to mourn with the family. I mean, I was very close with this family. I was not allowed to mourn with them. I wasn't allowed to come to the funeral. Basically, I was being sought after by South Carolina Law Enforcement Division, which is they were going to charge me with 2 counts of manslaughter, transferred alcohol to minors resulting in death. And at 24 years old, that was a pretty scary thing for me. So I did the only thing I needed to do, and I took off. I left. I ran, and basically just kind of went out until I turned myself in eventually. And they sentenced me to 10 years in prison, but they suspended that sentence down to 2 years of probation. And with that probation, I was to go and speak with all the high schools around South Carolina, talking about the dangers of drinking and driving, and how me purchasing alcohol for minors had resulted in their death. And it was during the Scared Straight program, and that was what they were spending a lot of their prevention money on, was Scared Straight. And so during those talks, when I would go to the high schools, keep in mind, at the time, I'm not a public speaker. I'm 24 years old. I played music in the band. I had really long hair. I was really intimidated. I was scared to death. I just lost my 2 best friends. And behind me, when I would do these talks for about 200 kids each time, they had a huge big screen where there was an image of the car that they were killed in. And it was there. And it was, this wasn't 2 years after this happened. This was like 2 months after it happened. So it was basically re-traumatizing every time I did it. And it affected me to the point where I was obligated to do it or I would go to jail for 10 years. But I didn't know how I was going to get through it. Each time it got more difficult. So I started taking pills. I had a friend who said, hey, I started out with Xanax, I think, a benzodiazepine. I started taking that and smoking a lot of pot and drinking a little bit and just to try to get through it and deal with my emotions. And once I started taking pain pills, I didn't realize at that moment the commitment that those pills were going to be when I started. So it was not my intention that I would end up a heroin addict within probably 4 or 5 months after I started taking those pain pills. Because once the pills ran out, the addiction didn't go away. I was still addicted, very addicted, and the pills were very expensive. Another friend introduced me to a much less expensive alternative in heroin. And throughout my addiction, my morals would go down a little bit each time. I would start out, well, I'm not going to ever do anything like that. And then before you know it, you are doing something like that. And then, that starts to play into your addiction, because now you got this shame and guilt of what you've done and how your moral standards have gone down. And now it's just like, why not go further now? Because I've already done all these things. And so that shame and guilt plays into it. And that's what happened for me. And within 6 months of using, I was already in my first treatment center, in a local treatment center here in Columbia called LRADAC. It stands for Lexington Richland Alcohol and Drug Abuse Center, where I tried to jump out of the second story window. This was back in the late 90s. And at that point, they put me there. I really didn't have any idea what the process was. This was my first time in treatment. Nobody really explained to me what was happening or what was going to happen, what I could expect, what I couldn't expect. And I basically just felt like I was just put there and they were housing me. And at that time I was very fragile. I was still intoxicated from, I'd overdosed on Xanax and heroin, and they took me in there and I was still didn't have my wits about me, and came up with this concoction. I was going to jump out of the second story window and slide off the awning and slide down the pole into a car that was waiting out for me. I called one of my friends to pick me up, and I didn't really expect him to show up. And then once he did, I felt obligated to carry out the rest of my plan. So, I hit the window. I got a running start, and I ran into the glass. And when I did, it was bulletproof glass, and it knocked me out cold. And that took me to my second treatment center, which was Bryant Psychiatric Hospital. They put me there for a 30-day evaluation because apparently what I had just done was not a sane thing to do, and they thought I needed to be evaluated. Again, I was able to talk my way out of it. Basically, talked to the doctor, told him I didn't need to be there, and even though I tried to jump out the window, there was really nothing wrong with me. So they let me go a little bit early, and I continued that cycle in and out of recovery, or not recovery, but in and out of treatment centers throughout my years, trying to get clean. I would go in. Well, I say treatment centers though, and there's a misconception that of what actually treatment is. At least I've noticed that with a lot of the families and people that I deal with, and, they'll expect that their loved one will go into what's really a short-term facility that's for detox, and they expect that they're going to sprinkle some fairy dust on them when they go in there, and the family's just, they're just going to come out of the facility after a week and they're going to be fine. And there's just nothing further from the truth. And the way the system is set up, especially here in South Carolina, we only have 64 detox beds in this whole state. If you do not have insurance, that's it. That's what we have. So I continued this, this cycle of in and out of rehabs. I tried different times, maintenance. I got on methadone at one point. And the problem with the methadone was I'm an active addiction, and I got to choose when I was at a therapeutic dose. Okay. And for me, I wasn't at a therapeutic dose until I was at 160 milligrams. And nobody should ever take 160 milligrams of methadone. There's just no reason for it. And there's no reason why a doctor should have signed off on me to get that, because they start me out at 35 milligrams. And really, that was a therapeutic dose for me. But I could go up 10 or 5 milligrams every 2 days, up until I got to 160 milligrams. And then it became, now I'm just trading drug dealers. I'm not buying heroin off the street anymore. I'm going to the local methadone clinic. And, a lot of people argue that that's safer than heroin. And I would guess maybe today it is, with all the fentanyl that's in the heroin nowadays. It is probably safer. But, I drove on 160 milligrams of methadone every day. And some days I don't remember getting home, and the methadone is great for blocking the opiates, but it didn't do a thing for the fact that I was still smoking pot. I was still taking Xanax, because what I wouldn't learn until much later is that my addiction was a symptom of my problem. And it really was not related to the substance. I mean, the substance was immaterial. It could be anything. And it was a lot of different things over the years. The opiates just happened to be the one that I stuck with the most because of the physical dependency. I checked myself into a place here that was attached with Richland County Hospital. I met a doctor there, a psychiatrist, and he put me on Suboxone. Suboxone was fairly new at the time, I think, and it was not widely prescribed as it is now. It was very, very expensive. Insurance did not cover it at the time. I did that for a while, and again, it would block the opiates, but it didn't do a thing for drinking alcohol, smoking pot, taking Xanax. And Xanax and these benzos and the opiates, they're both respiratory depressants. So I was still really in not much better shape than I was when I was using heroin off the street. So I continued doing that. The doctor that I was seeing, he lost his license, and I had a prescription. I was supposed to get my prescription filled that Monday. He lost his license, and I got a call on Saturday from his partner saying that he couldn't prescribe me anymore, that I was basically on my own. Good luck. And at this time, I was director of operations for Richland County EMS. I was a paramedic, and I was had about 45 people underneath me in a working environment. And I tried to detox myself. I went and bought pain pills and started taking them and tried to detox myself. And it didn't work because it just doesn't work that way. I relapsed, and shortly after that, I was on the news for stealing prescriptions. My wife and her whole family found out about my issue while I was in jail and I was on the news. That's how my in-laws and all found out that I'd had this addiction. So it was hard. I was embarrassed. I tried to do the same things I'd done before, go back into a short-term facility, get help, get clean, then come home and try to insert myself back in my old life as a clean person in my old life. And it never worked, and I never could figure out why. So finally, after another very major relapse where I got hit by a car and broke my thumb, and I was in a cast, and I told the doctor at the time that I was addicted to opiates, and he prescribed me oxycodone anyway. And he told me, he said, well, we'll manage the addiction later if it becomes a problem, but you'll need this. And because they were talking about I might have to have surgery. And so for me, I didn't understand that some people can take what's prescribed. I'm not one of those people. I have a disease of addiction, and it's akin to being allergic to something. If I'm allergic to something, I have a choice whether I take it. But once I take it, I do not have a choice the reaction my body has to it. And that's, for me, anyway, that's how opiates are for me. I do not have any breaks when it comes to that. It's all gas, and that's it. And that's not a moral failure for me. That's how it affects me. And so right after I got that prescription, I was back, found myself in a hotel, I had a $10,000 settlement. I spent $10,000 on hotel for a month and drugs, and that was it. And I walked out of there. I weighed 153 pounds when I walked out of that hotel after a month, and um, checked myself into the last rehab I'd gone to before I got clean. And my wife had asked me, like, she said, Bobby, what is number 12 going to do for you that numbers 1 through 11 didn't do? And all I can tell you is when I went to that treatment and I talked with my counselor, it was the first time I ever had somebody tell me that my substance use was just a symptom of my problem. And then I had to figure out what the problem was, why I had the need to medicate to start with. And that was the turning point for me. That was my aha moment. I was like, wow. I realized at that point that when my friends got killed, I'd never dealt with that trauma. I'd never dealt with those feelings of grief and shame and guilt associated with their deaths. And I started medicating after that, and then it became a physical dependency. And then it took on a life of its own. So they introduced me to some different treatments. I became very willing to try these different treatments. They gave me EMDR treatments, which is eye movement desensitization and reprocessing, where I would go there and they put earphones on my ears and it had alternating sound waves, and I would hold these paddles that had alternating vibrations. They can do some stuff with lights also, but I have epilepsy, so they did not do the lights with me. They just did the sound and vibrations. And we talked about, I basically relived the day that my friends got killed. I did that with a counselor in a safe setting. And I remember when one of the sessions would be over, I had held the paddles so hard that had little fingernail indentions in my hand from gripping it so hard. And she said to me, she goes, I really thought you were going to break those paddles. It was a very traumatizing event, and I had cried the entire time through it. I had my head leaning back on the chair. My shirt was wet because I just cried so hard. And I can tell you, when I walked out of there, I did those sessions twice a week for about a month or so, 2 months, maybe a month and a half. And every time I'd walk out of there, I could breathe a little better. The sky seemed a little bluer. I could hear the birds chirping. I mean, I started paying attention to the world around me, and it's like the world started coming alive. I didn't feel dead inside anymore. It became easier for me to talk about what had happened. They also did some treatment. They did acupuncture in my ears. I had acupuncture. They would put 5 needles in each ear, and they said it was specifically designed for opiate addiction. I would go in there, and they had a chiropractor that would come to Wilmington, and he would do the acupuncture, and then we would lay on the yoga mats. They had soft music playing, and we did that. I would lay there and just relax for like an hour and a half, and that was one of the things that I think made a really big difference for me, as well as I stopped smoking. I've been a smoker from the time I was in maybe 9th grade of high school, but I just stopped smoking. Once I left treatment, I've not picked up a cigarette since. So that was how I got clean. That was my journey. That was 5 years ago. And I've not used a drug or had a drink since. I've not smoked a cigarette since I left there. And there have been a lot of people that have been in my life that have made a huge difference in my recovery. And Becky is one of those people. And I don't know if you mind me sharing this, but when I was in Three Rivers before I went to long-term treatment in Wilmington, she was there at Three Rivers. And I tried to kill myself. I had bandages on my wrist. I'd cut my wrist with a razor blade, and I had stitches. And Becky came and she sat with me, and she was very, very compassionate. And she had a group of students with her, and I just remember being so embarrassed because I knew Becky from church, and I was like, God, I mean, this is like I'm at my worst, and I didn't want everybody to see me. I knew that having that bandage on my arm was just an announcement for what I'd done when I tried to kill myself. And she was so very compassionate and just spoke in such a kind voice, non-judgmental, and just said, we we are there for you, and anything we can do to help you. And it has stuck with me. There was also a CVS pharmacist who is on my board of directors now, who could have very well had me arrested because I would go there and try to scam pills from her, but she knew that I had an issue, and she also would talk to me in a very non-judgmental way, ask me how she could help, just try to be very understanding of the fact that I am responsible for my decisions. But when you treat somebody that's in active addiction like they're less than, or they're just a bad person, it feeds into that shame and guilt, and it doesn't help. It's hard to break that cycle. And if anybody's ever been through it, they would know that that is not a lifestyle that anybody would choose. The disease comes from a choice. It started with a choice. I made the choice to take the drugs to start with, but you can make a choice to have unprotected sex and get a very real disease that'll kill you, or make a choice to smoke cigarettes and get a very real disease that'll kill you. Getting sober was only part of it. And this was one of the things that helped me in treatment the last time, was that they taught me that getting sober was just the initial process. If I wanted to stay sober, then I had to change some of the behaviors that I had going on. So even though I had periods of abstinence, I was still a liar. I was still a thief. I was still deceitful. I was still had that addictive, criminal and addictive thinking, that behavior. And it was not until I was able to work on some of those moral failures that I was able to find sobriety. And through service work, doing service work, changing people, places, and things aren't enough. You'll hear that today. A lot of treatment centers will talk about that the person just isn't ready for recovery. They've got to hit their own bottom. Well, unfortunately today, with the opioid epidemic the way it is, and with fentanyl, you're basically playing Russian roulette every time you get high. And some people may not reach that bottom. I mean, they just may not. Some people, their bottom will be death the first time they ever try it. The first time they get high, they could be killed. I just went to a funeral December 27th. 28-year-old kid that I knew, that was one of my sponsees. He died from a fentanyl overdose. Had 6 times the amount of fentanyl in his body that would have taken to kill one person. He didn't reach a bottom. He didn't get there yet. He was, he is struggling. He had been in recovery for about a year. Went through a divorce. Young guy, just went through a divorce. His life started going bad, and he did not have the coping skills that he needed to get him to a place where he was able to reach out for help. And he got high again, and it was the one that killed him. Gratitude was a big deal. Me being able to be grateful for what I gained in sobriety, being able to acknowledge that. I think one of the biggest things that's helpful is that there are many different pathways to recovery. Okay, the old model is, you got to go to NA or AA. There's 90 meetings in 90 days, and they'll tell you that. But I went to NA. I went to AA. I didn't really like it. It wasn't. I didn't like the environment. I didn't like some of the, some people, some of the structure. I didn't. It was not for me. So I think what's helpful is for people to recognize that there are many different pathways. Today, there's smart recovery. There's celebrate recovery. We host refuge recovery here. It's like a Buddhist 12-step. Now, I'm not a Buddhist, but it has Christian principles. It has different steps for people. So there's just many different avenues. There are meetings now for people who are on medically assisted treatment. Even though that did not work for me personally, I think that it can work, especially with the fentanyl and the dangers of overdosing today. I think it's got to play a role for some people. and you could argue that it kept me alive long enough until I could get abstinence-based recovery. And I think that's one of the things that I would come away with that is the medically assisted treatment. But it has to be, there has to be more oversight on it. A lot of the people that are, prescribing it now, they don't understand that without the oversight, they're now funding the addiction for a lot of people, because I could take that Suboxone and go out on the street and sell it for 5 times what it's worth. And now I'm able to buy the drugs that I want to buy. And that happens more often than not. It really does. I would save a little bit just because if I couldn't find the drug of my choice, then I could take that and use it so I wouldn't get sick or go into withdrawals. But I could go sell it on the street and make 5 times what I paid for it. And now I could fund my addiction with it. So there's not enough oversight for it. And I think recovery is this. If I am depending on one thing in my recovery and I'm separated from it, no matter what that is, no matter whether that's a sponsor or a meeting or a medication, if I'm separated from that one thing and then I relapse, then I am not working good recovery. There has to be more to my recovery than just that one thing, so that if I'm separated from it, I still have my recovery intact. Does that make sense? I use one of this when I'm talking with some of my clients. I call it the Swiss cheese model, and it's Dr. Kevin McCauley. He's got a video called Memo to Self. It's about the science of addiction. I use it all the time, and it's different things that you use in your recovery. This one is called treatment, but treatment alone, it has holes, and so you have to layer it with different things. And so medications, or medications like I was bipolar, I needed to get some bipolar medication so I could start leveling out a little bit, and then go into meetings, and then you add sponsorship. So the thing is, the more things you add, service work was huge. Prevention. So prevention for me is I used Vivitrol. The Vivitrol shot is something that it was a shot that I could get once a month, and it was one decision I had to make. So you would make decisions when you were strong so that you didn't have to make those decisions when you're weak. So I can make a decision to take one shot, and that decision would last me 30 days. Whereas with Suboxone or something else, or methadone, I would have to make that decision every day. And there might be some days where I'm like, yeah, I'm having a bad day. I'm not doing it. I'm going to get high today. And so for me, being able to make that decision to take that Vivitrol shot that one time, it bought me a month. It bought me a month of sobriety. And I did it for 3 months as a buffer, and it was huge. There's no detox from it. You don't get high off of it. So there's no withdrawal. You don't feel any different whatsoever. It just blocks the opiates. And then for me, the last one was God. I had a relationship with God, and that was huge for me. And so I use this as a kind of visual aid for people I work with to teach them about how to layer things on their recovery. And those are just things I've learned over a period of time. So I want to ask if there's anybody that has any questions about any of the things I've talked about, and I would love to hear some of your feedback and answer what I can answer, and kind of see what your thoughts are on that.
This is Donna. I have a question as a bedside nurse.
Yes, ma'am.
You had mentioned your doctor that wanted to prescribe you opiates for your injury and said, we'll deal with the recovery after. So I take care of patients that have had heart surgery, which they require pain control after surgery.
Right.
And I've had several patients that are very reluctant to take any narcotics at all. And I'm not quite sure how to respond to that other than saying, this is for short-term use, for your acute pain, and, we'll wean you off of it before you go home. So I'm just wondering if that's a concern of yours, like if you were ever in a bad accident, or, how do you think nurses can best respond to patients that have concerns about pain medication?
I'm so glad you asked that. 'Cause I'll tell you, my wife and I were just having this conversation. So one of my biggest fears with 5 years sobriety is that, God forbid, I was in an accident or have some kind of accident where I am not awake or able to tell somebody not to give me narcotics. So much so that we were discussing me getting a medical ID bracelet to say that I am allergic to any type of opiate. And I know that seems extreme, but for me, that's what it's like. I think, and I don't think a lot of times people understand when you say wean somebody off of a narcotic before they go home. That maybe the physical dependency, but when I was in active addiction, that withdrawal lasted probably 4 to 6 weeks. Now, maybe not the physical dependence where I'm sick and I'm, going through all the chills and the cold sweats, but that mental obsession is one of the hardest things to overcome. And if you are truly addicted to that, then now you're asking somebody to use willpower. Okay, you have to use your willpower not to go back out and use this medication. Okay, so that's akin to me is saying that you have a disease, you have cancer, but I'm going to need you to use your willpower for it not to come back. And it just doesn't work. For me, it doesn't work. I've tried it a million times. The only answer for me is to completely abstain from it. I cannot have it in my system because when I do, my disease is progressive. It continues to get worse, and it's proven. It has gotten worse over the 23 years of active addiction. It got worse and worse and worse, and it took me further and further down. For me, I would have to, just for me personally, I would have to opt for something non-narcotic if I had to have something. I've had dental work done. I've had different things where I've managed my pain with Motrin and Tylenol. I would alternate every 3 hours, whether it's 800 milligrams of ibuprofen, and then 3 hours later I'm taking Tylenol, and I would do that for something serious. I had a back injury, and I did it that way. And I remember when they made pain one of the vital, the vital signs.
The vital signs, yeah.
And I'm just like, what? And that was basically to keep doctors from being sued for not managing pain, and I think you manage the expectation of the client that, hey, you are going to have some discomfort. We're not going to cut you open and you're not going to feel anything, that's not managing the expectation. You will be uncomfortable some. So I don't know if that answered your question. I know for me, it has to be a personal choice that I recognize that I can't, and when I got out of treatment, my wife and I went to my family doctor, went to my dentist, and I had them put in my chart that I am in recovery. I'm addicted to opiates.
Mm-hmm.
And I had a root canal done probably a year or so after I got into treatment. And my dentist tried to write me a prescription for oxycodone. And I dropped it like it had leprosy. And she handed it to me, and I was like, oh, wait a minute, I can't. And she's like, but I only prescribed you 5. And I'm like, I don't think you understand. Like,
Right.
If you prescribe me these 5, I'm going to need you to turn it over and write down your name and address on the back, because when these 5 are gone, I'm going to call you and I'm going to want some more.
Mm-hmm.
So that's just how it is, Does that answer your question at all?
Yeah, it does. I think, as far as nursing instructors and nursing students, it's going to take a change of mindset, because healthcare providers don't want to see their patients in pain. But at the same time, if I tell somebody, oh, just take your Lortabs for the next 2 days and, we'll get you off of it. And it's very dismissive of their concerns.
Well, yes. And think about that for a second. When you say we're going to get you off of it, what does that mean exactly? Like, so if I have active addiction, if you tell me that and I'm in active addiction and you give me enough Lortabs for 2 days and then you send me home,
Mm-hmm.
and in your mind, you've got me off of it because you wean me down
Right.
until I walk out the door.
And you can get it on the street.
But that's
Right.
that's not fixing my particular problem.
Right.
So my particular problem is that now I've had that in my system, and now I'm going to have that obsessive thoughts, and
Mm-hmm.
still may have some residual, health, still not feeling, you have the creepy crawly skin or the just restless legs and, kind of achy feeling. I mean, that's some of the things that really go along with active addiction. I mean,
Mm-hmm.
even after you're done, I mean, it's not always I'm in the bathroom, vomiting, you know, just over and over again. That has happened a bunch of times to me. And sometimes it's just runny nose, watery eyes, kind of cold chills, kind of feeling flu-like symptoms and just feeling icky. But that lasts for so long. It's not like it lasts for 2 or 3 days. It can last for a couple weeks at a time. And then you have that obsessive thought over and over,
Mm-hmm.
and you know that all you have to do to get rid of that is just pick up the phone or take this pill, and then you start the cycle over and over again.
Yeah.
So I think it's just having a real understanding of what that I'm going to wean you off and you're going to walk out the door and you're going to be good, what that really means for some people.
Right. All right. Thank you.
You're welcome.
So Bobby, I'm surprised. I didn't think you would remember that time when you were at Three Rivers. So when you, most often the, so to speak, untrained nurse, the one who sees the patient during their active addiction or their immediate sobriety, they're getting clean and their withdrawals. I don't know that I can safely say here those individuals are specially trained on engaging with patients correctly, whereas they would in long-term care or where you went in North Carolina. What advice or what things stood out to you in the care that you received when you were in that acute setting versus the long-term setting that were beneficial versus those that weren't, from, say, the nurses themselves?
Okay, so just as an example, like, and this has more to do with just the way the system here is set up, is that I can remember very vividly going to, because I don't know if you know this or not, but I was in Three Rivers twice within a 2.5 month period. You caught me on the second time. I'd just been there about a month and a half previous to that. And that previous day, I begged my doctor. I said, I am not ready to leave yet. I'm going to relapse. I said, I just don't think it's been enough time. And her words to me were, a little bit of fear is normal. It's normal to be a little bit afraid. And I'm like, I don't think you understand that. I'm not afraid. I'm telling you, I will relapse before the sun goes down if I leave now. And, and I understand the way it was set up. They're not a long-term care facility, but there was no follow-up. There was no follow-up with, okay, so if you're worried about relapse, let's figure out what your plan is after this so we can get you from door to door to somewhere else. We can't keep you, but we can help you get somewhere else. I didn't get any of that. I got, well, I'm sorry, but your time here is done, and have a nice day, and do your 90 meetings in 90 days kind of deal. And I don't think, so if you truly believe that addiction is a disease, then if you say, okay, I want you to leave here and just do your 90 meetings in 90 days, then you're assuming that, again, they can just use their willpower to go to these meetings and not use drugs. And it's just not true for a lot of people. Some people can, some people can't do it. I see a lot that the majority cannot. I think you have to be in a safe environment, almost a babysitting service. I mean, it really does have to be a place where it has to be hard for me to leave until I'm through that initial period of that obsessive thought period. And I think just listening a lot of times, man, listening to, like you did, you listened to me. You talked to me in just a very soothing and gentle voice. You assured me that I was not a bad person, I was a good person, and that I was just sick and I needed to get some help, and that, and you asked what I needed, how you could help. And I think just that non-judgmental, basically feeling like you're being pushed out the door. Like when I was there, they had given me a social worker They told me who my social worker's name was the day that I went in. I saw my social worker the day I was being discharged. I'd not met her before that day. I met her on the day she did my discharge, period. The next time I was there, I had the same social worker, and I still didn't talk to her, but I did have another social worker there. His name was Julian Green. He was not my social worker. I don't know if you know Jules, but Jules basically walked by and he saw me sitting on the couch. And this is another person that made a huge difference. He saw me and he just recognized that I was not doing well. And he said, "Hey man, what's up?" And I was like, nothing. He's like, "You want to go talk?" And I was like, "Sure." He wasn't my social worker. He had no obligation to talk to me, but he called me in his office and we sat there and talked for over an hour. He showed me compassion. He listened to me. He talked to me about other options. And he is the one who actually got me an interview at Wilmington Treatment Center and arranged for me to be picked up to go from door to door. Okay. Not my social worker. He wasn't my social worker. He was a social worker, but I wasn't on his caseload, So I think just recognizing a lot of it's just recognizing what that person needs. Recovery is not a one size fits all. I think AA and AA has been around since 1935, and it has not evolved much since then. But the drugs that people are taking and all those things have evolved. So you can't really treat it the same way and say, "Hey, just go to a bunch of meetings and that's going to fix everything." There has to be more. There has to be some kind of wraparound service. That's one of the things we offer here at Midlands Recovery Center is like, I work with people who are in treatment now, and then I'll go see them, help them put together a relapse prevention plan. Or, "Hey, what are you doing when you get out of treatment?" I'll pick you up from treatment and take you to a sober living home or and some other environment, whether it's an Oxford house, depending on what they need. If they need more of a structured environment, then I'll help them get to another place that's more structured. If they are doing pretty well in their recovery and seem very motivated, then I'll send them somewhere that's not as structured and they can get back to work. And it's kind of a step down process, not just the door's open, I'm gonna push you out and slam it behind you kind of deal,
So there's no relapse prevention plans that are put in place before discharge from acute care?
90 meetings in 90 days. So they basically put it off on, mutual aid groups, attend your NA groups, AA groups. And that's what it was for me. But, and it could have changed some since I was in treatment in 2014. But from what I hear from some of my clients, it has not changed. It's still, they still encourage you to do these things. And a lot of it has to do with resources. Now, here in South Carolina, especially, if you're on opiates, you have to have some other reason to be put into treatment. The opiates cannot be your primary reason because it's not an acute withdrawal. It won't kill you. You'll just be sick. It's not an acute withdrawal. So they will treat you in an intensive outpatient and put you on Suboxone. That is the standard treatment here. And it is not working. It is failing miserably. Because like I said, before, that's they're using this. If I could quit on my own and I didn't need to be basically locked away where I did not have access to the drug, I wouldn't need to be going to IOP to start with. I could use my willpower and I wouldn't have to go to IOP or anywhere else. So they're basically asking them to, and they're going to give them a drug and say, "I want you to take this responsibly," And so you're asking something of someone who is not in a place that can give it to you. I couldn't have taken a drug responsibly when I'm in active addiction if my life depended on it, obviously. And I think to go back to what the other lady's question was, if you're giving someone who is an addict a prescription of Lortab and saying, "Take these as needed for pain," you're asking me to make a good decision. And I have lizard brain, I can't make that good decision. If one feels good, 10 will feel better, and then I'm going to buy them on the street. Does that make sense?
Yeah, it sounds like the where you talk about the Swiss cheese and having multiple layers with the holes. It sounds like there's holes in their relapse prevention plans.
There is, and I think a lot of it has to do with just the healthcare system in general. And I do believe that the nurses are doing a lot. I mean, people are doing what they can. I met a nurse that was in Three Rivers that was actually in recovery herself, and she kind of gave me the wink, wink, nod, nod. I know what you're going through, kind of deal. And I think that was very helpful for me to be able to see. And that's one of the reasons why I share my story so freely, is because I shared my addiction with everybody with impunity, and I have to share my recovery because my honesty could help somebody else to see that there is a way out. And that's the thing. That's really the hope, is to let people know that there is a way out and there is a light at the end of the tunnel. And it's not easy. It's not as easy as just, hey, suck it up and go to a meeting. That's not as helpful as somebody who realizes how hard that's going to be and talks to you with some compassion, and does not make judgments against. I meet people every day who've done some bad stuff. I've done bad things. I've stolen. I've pawned things that did not belong to me. I've done a lot of bad things that I'm not super proud of at all. But those were things I've done and not who I am today. And an active addiction, I would never think to do those things. Would never even occur to me.
And I think that that's a great point, is that I think our nurses need to understand the science behind addiction, that it's not just that you can switch on or switch off choice, which you very well described, and the stigma associated with that. Because the science, what actually happens physiologically is really quite powerful. And I'm not sure we do a very good job of educating our students about that. And also, our nurses who are either in rehab facilities or in acute care. If somebody comes in who does have an addiction but is being admitted for some acute illness or injury.
Yes. I tell people a lot of times, I'll describe it as, your brain, if you can imagine being in the desert and having a flash flood in the desert, and that water, the desert's not seen water in a very long time, and then it just floods the desert and it creates all these caverns where the water just flows down. It's kind of similar to the brain when you get that dopamine release. It doesn't really create caverns, but it's the same principle as the dopamine flood. It creates all these little caverns in the brain, and then when the dopamine stops, the caverns are still there. Just like in the desert, the cavern, when the water dries up, they don't go away. They're still there waiting on that dopamine to come back, and it's just a lot of people, their brain is not producing dopamine normally. And so I encourage people to do things that they've forgotten that they like to do. Like in my addiction, I'd forgotten the simple things that used to give me joy and produce dopamine normally, in a natural way, normal levels of dopamine. And so that's one of the things I encourage people to do, is try to get back to some of those things that they used to enjoy that would bring them happiness and helps create that normal rush of dopamine instead of that artificial flood of dopamine that they were getting from the drugs. And once you stop using the drugs, it takes a while for you to produce that normally again over time. And that's where that obsessive thoughts and those depressed feelings, and too often we're a society that doesn't know how to deal with normal feelings. I want a drug for everything. If I'm depressed, I need a drug for it. If I'm anxious, I need a drug for it. So it's just learning how to manage normal feelings and manage those expectations, I think, is huge. So.
Does anybody else have any questions?
I just wanted to comment that what you just said is part of trauma-informed care. That when you're trying to help people to deal or to connect with their senses, when you have them in a situation, because so many of the individuals that I volunteer at a drop-in center on Thursday nights for opioid addicted women, many of whom are victims of trafficking / prostitution. And so many of individuals, I happen to live in the state of Ohio, which is second in the nation for opioid overdose deaths.
Yeah.
So we see a lot of, I work primarily with women, but we see a lot of, individuals who are addicted, and many of whom have sustained trauma before their addiction and certainly trauma throughout their addiction. And that's one of the things we do in the drop-in center. One of the strategies that we use is providing a quiet, warm environment. We feed people, we provide personal care products and clothing for them, and talk one-on-one with them. And that, helps with that normal trauma response that they can have. But what you said just perfectly describes it. And we've surveyed some of these women, and they confirm exactly what you said. You guys, you people treat us like human beings. You're non-judgmental, and that's why they keep coming back week after week after week. We just need to expand this to what we found is even so many of these women have warrants for their arrest. They go into the Franklin, our county jail or into the prison, and they're withdrawing in the jail. And like, for example, they get put on a top bunk while they're withdrawing.
Wow.
People don't understand how to care for people who are, addicted, or even who are actively withdrawing while they're in your care.
Yep.
So, there's so much, I just feel like there's so much work that needs to be done on so many levels.
One of the stories, I don't even know if Becky knows this, but when I was in Three Rivers and I was going through withdrawals, and I don't want to be graphic, but I was very sick.
Mm-hmm.
I mean, I was going through some really hard withdrawals. And before they would give me anything for the withdrawals, they would not let me flush my toilet.
Mm-hmm.
I guess, and I understand why. They wanted to see how much or how often I had vomited or whatever. But I mean, my bathroom looked like a crime scene. I mean, it was terrible. I felt bad for my roommate. My poor roommate had to go and use somebody else's restroom, and I literally laid there suffering. In a bathroom, and that's dehumanizing. It was terrible. I mean, it was, it's all over the floor. It's all over me. I mean, and it was hard. That was a hard moment. And, the one thing that I can remember is that there was a male nurse that came in there with a warm rag and sat beside me and wiped my mouth for me and wiped my face. And those are the things that I remember. Those are the things, even in that state of mind, that I remember. And I think the biggest thing is that recovery is not an event. It's just not an event. It's a process. It takes time. Not everybody gets it the first time. Hell, I didn't get it the 12th time. I mean, it took 12 times in treatment, and I can't even count the relapses before I got it. And I should have been given up on a million times, and people would have been justified in giving up on me, I guess, because of some of the things I've done. But, and that's one of the things I remember when I'm helping somebody else. I don't take it personally. I understand that I'm talking to a person who is managing my expectations of what they're able to do is huge. You cannot expect somebody to do something when they are not in that point yet. They're acting irrationally because this drug has changed who they are. And I think Dr. Gabor Mate says that all addiction is based in some kind of trauma. And I believe that. I do. I really do. And it might not necessarily be something as traumatic as what happened to me or some of these other people. But I always tell people it's not necessarily what happened to you, but it's how you deal with what happened to you kind of deal. I know a guy that was bullied in school, and it was very traumatic for him. While that may not be as bad as somebody who is in human trafficking, but for him, it affected him, and it caused a huge problem. So I think not minimizing what somebody's gone through or how it's affected them. Even my parents didn't understand that my friends getting killed was a huge issue for me. They were like, just, you've got to get over it. You've got to get over it. You've got to suck it up and get over it. It wasn't your fault. Move on. And while that sounds great, it's a lot easier said than done, So sounds like you're doing some good stuff. I appreciate you sharing that with me. Very cool.
I love it. I love the ladies and I love the work. So
that's good stuff. That's the stuff that counts right there. Keep doing that.
Beverly, you had your hand raised.
Yes. Hi, I hope you don't mind if I just ask a question. I've been listening intently, and Bobby, I commend you for everything that you're doing and paying it forward. How do you deal with things day to day? I'd like to know. Is every day a struggle? Or do you have children? Do they, I'm sure they know what's going on, and how's your day-to-day life? If you don't mind my asking.
No, I'm glad you asked. My day-to-day life is phenomenal. I am luckier than anybody should be, and blessed. I mean, I have 2 beautiful kids. I have a 10-year-old boy and a 4-year-old daughter. And I'm glad you asked that because, I was on a television show about 6 months ago. I've gotten a lot of news coverage. Apparently, it's such a huge deal that Bobby Brazell got clean that the news media thought they would do. So, anyway, so my son was upstairs and I was on this 30-minute program and my wife and I were watching it, and he comes down and he's like, Dad's on TV. And my daughter's like, Daddy's on TV. And so they run downstairs. And so my wife and I kind of looked at each other like, uh-oh. And she's like, what should we do? And I'm like, let him listen. And so he was 4 years old when I went into treatment the last time, when I went and got sober. My daughter was maybe 6 months old. So they don't really remember a lot. But he sat down and he listened intently. And I didn't go through the gory details or any of that. He understands that Dad had a problem with addiction. He understands what addiction means. He knew that I was sick, and he knows that I am no longer struggling with that, and I'm now helping other people. And, I don't know that I'll have to tell gory details later. I'm very open with him about the struggles that I've had and about addiction and how I maintain my sobriety and the things that I do. And to answer your question, it's not a struggle, and it hasn't been a struggle for a very long time for me. I mean, and I'm blessed that way. I think it's just something that God took from me. It's a God thing, in my opinion. I truly believe that. And I think it really has to do with the fact that I dealt with the issue. The issue is not the drugs.
Right.
They played into the problem, but the issue was that I had not dealt with the grief and shame and guilt associated with my friend getting killed. And I was able to do that effectively. The addiction went away. It just did. Today, I would have to make a conscious choice that, hey, I'm going to go get high today, and I'd have to seek it out. And that's just not in my mindset today. It's just not. And I'm grateful for that. Life couldn't be better. I mean, I can't even imagine. I look at that person, I don't recognize them anymore. I just don't.
Good for you. Not to be proud of. Thank you.
My wife's the one that needs the medal.
I'm going to tell you said that.
Yes, man. I'm telling you, we've been together 13 years, and I put that girl through it. I'm telling you.
Okay, Valentine's Day is right around the corner.
Oh, I'm telling you. I tell her every day how lucky she is to have me, but she doesn't believe it yet.
Anybody else have any questions? Well, Bobby, I appreciate very much you coming and speaking today, and I have loved watching you get healthy over the last 5 years. I can't believe it's been 5 years, though. And I'm happy for you guys, for your whole family.
You're part of it. You really are. You have no idea. And so you never know when your guys I want you guys to hear me. You never know when what you say to somebody. I make it a point. I have a sign in my office that says every conversation counts. And just remember that every conversation you can have with somebody, it counts. It means something. And you don't know when you'll have a conversation like Becky had with me that has made such a long-standing impression on me. So just speak with compassion and listen, right?
Yeah, it's funny because the time we saw you out at the Waffle House right after you got out of rehab, I kept it private that I had seen you in rehab. And so when you divulged it during that brief interaction with Steve and I, afterwards he says, well, you didn't tell me you saw him. And I said, no, I couldn't tell you. And I said, it was private. And I said, I didn't even know he had addiction problems, which you were really good at hiding. And he said, oh, I knew that. Like, well, I didn't. It was kind of a funny story. I wasn't in the know.
Wow,
But
that's cool. But yeah, and it just, every conversation counts, man. I mean, it means something, and you don't know when what you say to somebody is going to be, the thing that they remember. Even if it's just showing compassion. I mean, I've had people throughout my journey that have helped tremendously that I don't even think they'll ever know how much they've helped. And it's always been the ones who have understood that I'm not a bad person. I'm just very sick, and I needed that help and that compassion to understand it, right? So I appreciate you guys very much, and it means a lot that you guys want to know more. That's the things that's going to make a difference, is that you want to learn more about it to help others. So that's awesome. Thank you guys.
Thank you.
Thank you, Bobby, and I'll see you.
Thank you.
Have a good night.
Thank you.
Thanks.